Welcome to usmlepoint, guys. Today's topic is diverticulitis. This is a very important topic for Usmle examination, especially for step 2 CK and step 3. Let me start with this. Below you can see I have written the age more than 70 years old. So Usmle they usually give the history of patient older than 70 years old. Remember, very important point. There are other important point also, but the important point is the age of the patient. It is not seen in young patients. Okay, before knowing what is diverticulitis, we need to know what is diverticuli. Diverticuli is a small pouch created by herniation of mucosa into the wall of colon. When does this happen? When there is a weak wall of the colon. When does this weak wall of the colon happens? When the patient gets older, right? So it is seen in the old age. So this pouch, if they herniate, it is called as a diverticulosis, and they cause painless bleeding, which I will discuss in another video. This is diverticulitis. If there is an infection of this, then it leads to diverticulitis. How does it present? He presents with a few symptoms. That is, left lower quadrant pain is the most common presenting complaint. Remember, this is a very important point you need to remember. Left lower quadrant pain in an old age, more than 70 years old, with a left lower quadrant pain is usually diverticulitis. Okay, there are other symptoms also, like a fever, tachycardia, and everything that are associated with the infection, right? So pain is often described as a crampy and may be associated with a change in the bowel habits. So patient may tell you change in the bowel habits recently, maybe diarrhea, maybe passing of blood, something like that. So okay, so the other possibility is the carcinoma of the colon also. Remember, other symptoms include nausea, vomiting, constipation, diarrhea, flatulence, bloating. Symptoms of mild diverticulitis may be confused with overlapping symptoms of irritable bowel syndrome. Okay, diagnosis. Since it is a small topic but very important, so how do you diagnose it? The most important, what you need to diagnose is by clinical, by signs, symptoms. Age, old age more than 70 years, left lower quadrant pain. Okay, then do the CT scan. CT scan of the abdomen is very important. Why we don't do endoscopy like colonoscopy? Because it's an acute stages. Colonoscopy is not used. It can exacerbate the infection, it can spread the infection, right? And it can perforate the bowel. So that's why we do CT scan of the abdomen. Why we don't do plain X-ray? CT is far better than X-ray. Okay, if you are suspecting, X-ray can only show the obstruction, whereas CT abdomen you can see the soft tissue and you can diagnose diverticulitis easily. How do you treat it? Well, this is the infection, so you need to treat it by the antibiotics, that is ciprofloxacine and metronidazole. Okay, since it's a very small topic but very important to know, very important for CK and step 3, so try to know how to diagnose it clinically, how it presents, presentation, what's the next best step, why CT scan of the abdomen is best, and how do you treat it. Thank you so much for watching my video. Please do subscribe.